When a patient comes into an appointment, I really want to make sure I answer their question, because oftentimes people come into the allergist and they had something happened, right? They had something happen with the drug, something happened with the food, and they want to know what happened. And it may not always be an allergy in the way that I think of them, in the, like an immediate type allergy we can do all this testing for and it's life-threatening, but it doesn't mean that something didn't happen. And so I try to, even if I rule out some serious things, or I rule out, say, like, no, it's not really an allergy, it's actually lactose intolerance or something like that. Like, I want to have an answer for the patient when they leave that day, or at least a plan for an answer. I think patients are really suffering from some of their diseases. A lot of things that we deal with in allergy are not life-threatening, but it doesn't mean that it doesn't affect your life on a daily basis. That's what chronic sinus disease actually has one of the highest levels of misery associated with it, even more than, say, heart disease or kidney disease. Like, people just, because you can't smell, you can't breathe through your nose all day, every day, and it never gets better. And that's really miserable for patients. And I really want it, when patients have told me that, like, when you leave my clinic, you have hope that there's a plan and that things can get better. Because I think that no one needs to muddle through allergies. No one needs to be living with this discomfort all the time. We actually can make you feel better. The most rewarding aspects is making people's lives better. Right, when somebody comes in with severe asthma and they're, I'm waking up every night, I can't exercise, and we can start medicines, we can do, inhalers or biologics or other treatments, and then suddenly all of those things that were left out of their life now are back into it, and they're like, their life gets better. My name is Jackie Eastman, and I am an allergy physician here at Spectrum Health Medical Group.